Welcome to Facts TV News, where everything is true. Singer Karen Semet has died. Popular singer Karen Semet is dead. Semet, who was battling colon cancer, died in the Bay West Wellness Hospital in St. James on Saturday morning. She was 61. Her husband, veteran bass guitarist Jackie Jackson, confirmed her passing. She passed at 3:10 this morning. She was diagnosed with stage 4 colon cancer last year September and did the surgery in early October 2020. She did chemo, radiation, and nothing helped, Jackie reported a short while ago. How I see it, the time came, and if the Lord says come now, nothing can stop it. I will always remember her. Unforgettable, he continued. A former president of the Jamaica Federation of Musicians and Affiliates Union, Semet is known for her broad range of musical styles from jazz to reggae. 48 CRH nurses exposed to COVID-19 placed in quarantine. About 48 of the 377 nurses assigned to the Cornwall Regional Hospital CRH are now in quarantine after being exposed to COVID-19 patients and suspected of contracting the respiratory disease during their line of duty at the facility. The 48 of the pool of nurses include registered and practical nurses. When you are looking after the COVID patients and we suspect that you might be exposed to the disease, then we will have to put you off work until we are sure that you are not infectious before you can come back, said Delroy Frey, Clinical Coordinator at the Western Regional Health Authority, WRHA. According to Dr. Frey, it is customary to quarantine healthcare workers who have been exposed and are suspected to have contracted a disease. He added that doctors have also been quarantined after being exposed to COVID-19 patients. He said he did not know the number of doctors who were under quarantine, but added that he would have known if it were a significant number. He conceded that the 48 out-of-service nurses have forced the matron to juggle other nurses to fill the gap. So what that means is every shift the matron has to address some roster to fit what needs to be done. So it's a bit of juggling. Sometimes we have to bring back nurses from leave. Sometimes we have to move some of the clinical area to come over. So that type of juggling is required. So that is what is happening, he said. On Thursday, September 9, Jamaica recorded 638 new COVID-19 infections and 8 deaths. The new cases moved the total number of infections to 74,645 since the first case was recorded last year, while the death toll climbed to 1,693. Prime Minister's vaccine tour continues in Olympic Gardens.
Not the easiest experience to go and get the vaccines. Government is working on that to make the sites that are administering the vaccines more accessible and to have more sites all around the country that will be open for more days and for longer hours to make the process of getting vaccinated more convenient. But the ultimate test will come if, God forbid, you get infected. But you probably won't need to go to the hospital if you get sick. And the probability of you dying if you got infected would be very small compared to those who don't take the vaccine. And if, God forbid, they get ill, the probability of them having to go and be admitted into the hospital is very high. And they have a much greater probability than you do of dying. So what we do know is that the vaccines save lives. Most people you talk to, they say, go and watch it. I hope they don't watch it until it's too late. So what we're trying to do is to demonstrate to them that taking the vaccine is safe, and the more people come out, the more people will understand that yes, it is safe, yes, there's nothing to fear. And a lot of them don't know what the process involves to get the vaccine. They think it's something complicated. So we have to kind of demystify it, show them what inside the vaccination hall looks like, the process of the vaccine. And hopefully we'll get more people to come. And people are actually seeking information. People are actually going on the internet and reading so which one is more effective. Now, you know, I read all the information. It's very complicated sometimes to decide. So I believe in principle number one. The first vaccine you get is the best vaccine. That is it. For those who believe that it is going to take up a lot of your time, as you can see with this one, it does take some time, but it's not a very long time. Yes, the registration seems to me to be duplicated. It's written and then transferred digitally. It's a pity that we didn't have the NIT in place, because with the NIT, it would have just been all digital. We would just access the NIT database, verify with a fingerprint, and that's it. Good morning, West Central. Good morning. Good morning. Good morning. As I look in the audience, I see people from all over. I see some people who I know, and I see some people who I don't know. I see some not so young people, and I see some young people. For those of you who have decided to come out, I know it's not an easy decision all the time. You have to think about all the other things you have to do to spare the time to come, even though it's for your own benefit. Then you have to hear what the other people are saying. You have some people telling you that don't take no vaccine because of chipping of the vaccine. No, I don't. The way that the needle is small, I don't know how the chip can go through that. Right? Then they talk about magnet. Then you hear all kind of something. Then you have those who say, God will do everything for you. You don't need to do nothing for yourself. Then you have people who say, "Chum, me can't bother, me just have the time." Now, the country is in a crisis. But your household, your yard is in a crisis too. Because some of you don't work since COVID dropped vanilla. Some of you who have to keep party, because you know we have the hip strip and that is a big part of the economy of this constituency. The party can't keep. Even though I know that some of you are thief and keep party. But it does affect you. The only way for us to come out of this, both the country and your household and your family and your community, is for us to develop immunity. Every day we hear of a new type of corona, a new variant coming in. And who did attack first? It attacks the persons who are not vaccinated. The unvaccinated population creates a fertile ground for these viruses to thrive. What we have to do is to get everybody vaccinated who can be vaccinated. And that will ensure that there is no population, no fertile ground for which the virus can infect and reproduce and spread. I am not telling you that vaccines don't have risk. There is nothing in life that is without risk. There is no medicine that is made that doesn't have a risk. But what we know is that the risk of the coronavirus and the COVID-19 disease that it causes is much greater, far greater, hundreds of times greater than any risk of the vaccine. So I am imploring you. I don't have to implore you, you are here already. But for those who are hearing this virtually in social media or on television, I'm urging you to come and take the vaccine.
Prime Minister, there have been anecdotal reports of COVID protocols not being observed at the entertainment. What will the government be doing about that?
It's a very, very good question. Minister Bartlett, in his regular reports to me, has always stressed that hotels are very consistent and almost religious in following the protocols. That you have raised this question with me, I will bring it to Minister Bartlett's attention. From my interactions with the hoteliers and those who operate within the industry, they guard very jealously their good record of ensuring that they don't have any massive outbreaks in the sector, and I think we can commend the sector for that. But if these are issues that are now arising, I certainly will bring it to the attention of Minister Bartlett and reinforce that tourism must continue to be an example of how an industry manages in terms of the rules that are in place to ensure that the industry remains open. The main deliverable for the task force is to ensure the convenience of vaccination. When we did our analysis of the vaccination program, yes, there is hesitancy and fear and even mischief and misinformation. But a large factor that accounts for why people will come out and take the vaccine is the convenience issue. People want to be able to leave their work, leave what they're doing, spend 30 minutes maximum and be out of there. Right now, people are having to spend an hour, probably 2 hours. If it's overcrowded, I've been told people are even spending up to 3 hours. And the main objective, therefore, is them to reduce the wait time, make it more convenient. If you unpack that, then you would want to have more sites open more regularly, and sites that are in close proximity to population centers and sites that are easily accessible. If you go a little bit deeper, it means we need more vaccinators to man the sites. So we need more nurses and doctors who are trained in delivering the vaccines, in managing the cold chain, and in just managing the crowd that would come to get the vaccines. And that means that we want to have a set of persons who are not necessarily employed or engaged in the public health sector, because if you have to take persons from public health to do this, then the other public health functions suffer. So we literally have to build out an independent core of vaccinators to be able to run standing vaccination centers that are open for long periods of time, very regularly, in areas where there are large population centers. And of course, you have to have a mobile remote strategy where you are able to bring the vaccination program to populations that are in remote areas.
On the confirmation of a second variant of COVID in Jamaica, can Jamaicans expect stricter measures going forward?
One thing I would say regarding the government's strategy to manage the pandemic, we cannot continue to lie on these blanket non-clinical measures, such as restricting gatherings and movements. They have a devastating impact on economies, on lives, on livelihoods, on the mental health of the people. It is already starting to affect the mood of the people. People are, having a pessimistic outlook on life. And once that begins to seep into the psyche of the population, all kinds of things can flow from that. So the government has to be very careful not to create an atmosphere where people are fearful, where there is panic in the society, where people start to become fatalistic because they have been locked in and restricted. So I'm just saying this because I've said it already, that we cannot rely on these measures forever or for an extended period. What that means is that each citizen has to take greater responsibility for their own health and for their own safety. Manage your own social behavior. So that has to be the new thrust and the new message, that every citizen has to take some responsibility. These blanket measures of locking down and curfews, whilst they do work in bringing down a spike, but if you keep them longer than is necessary, they can have negative impacts otherwise.
Please remember to subscribe, like, share, and click the notification bell for daily updates.